All right, we're going to go ahead and get started. I'm going to turn it over to Dan Klein, Chair of the Legislature. Thanks, Dan.
Thank you, Dominic. Welcome, everybody. Thank you for being here today. Hoping the rain holds off for a few more minutes. I'm Dan Klein. I'm Chair of the Tompkins County Legislature. And today we have members of the press with us and county and city officials, community partners, and agencies. Tompkins County doesn't hold events like this very often, and I hope that us being here today signals clearly how pressing the challenges are and how important these developments are that we'll be talking about today. Today, you'll hear from our County Administrator, Lisa Holmes, Legislators Travis Brooks and Greg Mezey, Liddy Bargar from our Continuum of Care, and City of Ithaca Mayor Robert Cantelmo. We are here today to announce that Tompkins County will purchase this property at 227 Cherry Street in the City of Ithaca to develop a purpose-built shelter facility. The Legislature will authorize $1.1 million purchase at our meeting on December 3rd. An additional $1 million is in our budget for the local cost to develop the shelter. And we will apply for over $6 million from New York State, the Homelessness Housing Assistance Program, which hopefully after this, when we say HHAP, you'll know what we're talking about. And we hope that will cover the rest of the development costs. What we envision here is a 20,000 square foot, 100-bed shelter on this site. More than a dozen sites were considered before we chose this location. And it may feel like it took a long time since we first announced that we would develop a shelter, and it has been a long time. We've been doing our due diligence, and we had to do that to ensure the best development opportunity with this significant use of public funds. This 1-acre property is nearby several existing homeless encampment areas and service providers. This project can only be successful with the involvement of the community. We will hear from people with lived experience of homelessness, service providers, and experts before a shovel ever hits the ground on this site. And with that said, we recognize the immediacy of this issue, and frankly, we needed something like this many years ago. Today, our system simply lacks the capacity to meet the needs of people experiencing hopelessness in our community. Hundreds of people experience homelessness in Tompkins County in a given year. Nearly 1/3 of people experiencing homelessness reported returning to homelessness after securing a permanent destination. Outcomes are worse for young people, they're worse for people of color, they're worse for people with disabilities, and they're worse for people experiencing mental health crises. Tompkins County is in a position to significantly strengthen our shelter system, giving as many people as we can a safe place to go and a reasonable path out of negative situations. This development will also serve the community at large. It is also our goal to make sure that neighbors feel safe with this new development being added to the community. We agree with the vision of making homelessness rare, brief, and one-time. This requires big thinking and strong partnerships, and it also requires investment. Millions of dollars have been put forth by Tompkins County, including over $1 million to purchase this land on Cherry Street. We're proud to have secured contracts for THA beds and dozens of county staff to operate Code Blue this winter. And now I would like to introduce Lisa Holmes, the Tompkins County Administrator.
Thank you, Dan. So this is a huge moment for our community. We are adding significant capacity today to our emergency shelter system while planning for the future. Emergency sheltering is not the only needed solution to homelessness, but it is a core function of our system that needs to be shored up and part of the county's responsibilities to serve people experiencing homelessness. I'd like to first thank the Tompkins County staff who have made these announcements possible. Our government staff have literally dropped lower priorities and doubled up on work to get us to this point, and that must be recognized by everyone present today. Our Department of Social Services, led by Commissioner Kit Kephart, have been pivotal in standing up our emergency sheltering system in demanding circumstances. They are the first point of contact for people seeking shelter and assistance programs. They have stood up shelter operations internally for the first time in recent memory, and they have contributed to the planning for a stronger and more equitable system in the future. I can attest to their round-the-clock shelter preparations and services to our community. So please join me in thanking our DSS staff. There are three primary topics related to emergency shelter we're covering today: the new shelter at this property, expanded THA shelter capacity, and the opening of our temporary 2024-2025 Code Blue facility. So first, for the shelter to be built on this site, we've identified a development consultant named MMDA Advisors who will lead the development process. We will be working with the MMDA project team to design a shelter that prioritizes accessibility, safety, dignity, and inclusivity for all residents, ensuring it meets the diverse needs of the community. They understand our aggressive timeline to see this development happen. The new purpose-built shelter will provide a safe and welcoming environment for individuals experiencing homelessness, with a particular focus on those facing significant barriers to accessing traditional shelters due to factors such as substance abuse, mental health issues, or past trauma. We will be engaging our community in that process. In addition to building a new shelter, we are announcing expanded capacity to serve individuals through our Temporary Housing Assistance Program, or THA sheltering. Temporary Housing Assistance is a state program administered by local departments of social services to provide cash assistance and access to services for families and individuals in need, including those experiencing or at risk of homelessness. We are going from having a 26-bed facility to having contracts for additional scattered hotel rooms to shelter upwards of 90 people as needed. We will have more space for programs and service providers and more private settings for guests through THA. At first, our DSS staff will operate the new THA shelter sites directly. We will continue to seek a not-for-profit operator for THA in 2025. And lastly, we can share that our Emergency Code Blue facility, a congregate shelter, and a repurposed former bank building downtown opened for guests last night. The first evening did not drop below 32 degrees, so while it is prepared for guests, no guests utilized the facility on its first opening evening. We anticipate operating this facility through April before seeking a not-for-profit operator for the next Code Blue season. So a special thanks to our staff in facilities, ITS, emergency response, and administration for working with social services staff to make this emergency option a reality this year. And with that, I'd next like to introduce Legislator Travis Brooks from District 1.
Good morning, good morning, good morning. I'm proud to represent this area in the city of Ithaca. I want to thank the neighbors here today and service providers that are ready to collaborate with the county to create the best possible outcomes for those needing these services. Folks know that besides being a legislator, I work at GIAC, serving people from all backgrounds in this community. We expand opportunities and provide recreation to build community. I see the need for a better housing system and emergency shelter system. This is one piece of a larger puzzle. When people are struggling, they don't want services scattered all around the community. They want to be able to get help in one place and where they're when they're ready. I see a future where we can do that. Bring support for people without a place to call home into more central area, while hopefully making a dent and reduce the number of people who are homeless in our system. The county will play a significant role in offering resources, but it'll be our community and the agencies that can do this work and make a big difference. Next, you will hear from Legislator Greg Mezey, who chairs our Housing and Economic Development Committee.
Hi, thanks everybody for being here. This Cherry Street Development Plan gives us a chance to look past the temporary solutions that we've had to stand up and think big about what's possible in the future. Having a purpose-built facility in the city will allow us to shelter people close to services, even bringing many of those services under the same roof as the shelter. This isn't the end of the road for addressing homelessness. Even when we grow our capacity, we need to identify the right operational approaches, strengthen partnerships with other local governments and not-for-profit agencies, and look to other solutions like transitional housing and other critical supports. Tompkins County continues to explore the possibility of a low-barrier approach to this shelter. Community partner agencies will be engaged in a process to explore options to lessen barriers to the shelter. I encourage the press and members of the public to follow the Housing and Economic Development Committee at the Legislature to receive ongoing updates as it relates to this issue. I'll next introduce the Tompkins County Continuum of Care staff lead, Liddy Bargar.
Hello, good morning. My name is Liddy Bargar. I use she, her pronouns. I'm the Director of Housing Initiatives at Human Services Coalition. The Continuum of Care is a program by the United States Housing and Urban Development, HUD, dedicated to organizing a community-wide involvement in preventing and ending homelessness. Ultimately, the goal of the COC is to make homelessness rare, brief, and one time in our community, and to rehouse homeless individuals and families while minimizing the trauma and dislocation caused to homeless individuals, families, and communities by homelessness. The COC does this by promoting access to supportive housing and other supportive services for individuals experiencing homelessness through our coordinated entry process, as well as through organizing community planning and education regarding building a more trauma-informed, housing-first homeless response system. Following the findings of our most recent homeless and housing needs assessment, the Continuum of Care believes that the only way to end homelessness is by expanding access to housing opportunities across our continuum. The COC intends to make a cultural shift in how we think about housing and homelessness. Our community currently lacks safe, habitable spaces where people can stabilize and live indoors at low or no cost. Developing emergency shelters is one component in the Continuum of Care to serve the population. It will take more permanent supportive housing, enhanced housing navigation, and outreach to at-risk populations, as well as ongoing collaboration across government and not-for-profit agencies to reach our goals. Homelessness and poverty are some of the biggest challenges facing people in our community. What's clearer than ever is that alleviating homelessness will require all of us working together with compassion and persistence to help lift people up. We can come together and provide stability, services, and supports to clients. We have to recognize that having a roof over someone's head is a proven strategy, made stronger when supports are available and easy to access. Homelessness is a significant public health issue, with increased risk of chronic disease and barriers to accessing healthcare services. Of those entering our emergency shelter system in 2023, 38% self-reported a mental health disorder, while 15% reported chronic health condition. The Continuum of Care is committed to being a partner in this process and convening stakeholders to help make local emergency shelter development successful. This will only be as successful as the broader supports are. Ultimately, the goal of the Continuum of Care is to collaborate and aid in the vibrancy of the not-for-profit sector and to serve people in need. Please welcome our Ithaca Mayor, Robert Cantelmo, for some closing thoughts.
Hi, everyone. Again, thanks for being here, and special thanks to my county colleagues for inviting the city to be part of this today. I want to just quickly echo what Lisa said about the enormous work that the staff put into this, and I know how long and how thoughtful the county has been about this. I also want to just thank my colleague Dan Klein, whose leadership on this has been really, really instrumental, and I think represents a high watermark for city-county relations in recent years. And so we are really heartened to see the county taking this step forward, and I want to thank you personally, Dan, for the work that you've done with your team trying to get this together. Folks have heard me say before that the City of Ithaca can and should be a place for everyone. And so I am glad here today to be a part of recognizing what the future of our emergency shelter system will look like. Having a purpose-built shelter facility and a network of supportive services are absolutely critical to our city. The folks who are experiencing unsheltered homelessness are residents in this community just as much as anyone else. And it's really important that we keep that knowledge centered as we think about looking for a way forward. The county does tremendous work in providing supports as well as our community partners in an area where, frankly, we don't see the federal and state leadership that we should. And so I want to just let that sit with you for a minute as you think about the plights that folks are grappling with, whether it is substance use, as mentioned, or unaddressed mental health. These are areas where we need to see significant investment so that we can stabilize folks' lives and help them move into what is hopefully better conditions from their non-recurrent experiences with unsheltered homelessness. The city's glad to see that the progress the county is making, and we stand ready to continue to partner with them and contribute where we can, now and in the future. What's clear now more than ever is that we all need safe, accessible, and supportive places for folks to go that we can develop. So thank you again to the county for your leadership and your efforts to make these significant systemic changes. And I think now I'll turn it back over to Dominic Recchio. Thank you.
Thank you all. Just a few housekeeping items. We'll be distributing a press release with details, including some of the speaker's remarks to our entire press list after this. There's also a fact sheet that has all of the relevant details to the announcements today that has been distributed and will be attached with that. The county will also be distributing photographs of the event and video for any media that would like to use those today or tomorrow, later this week. And at this time, we're going to take questions from press if you have any. And that'll be direct. You can direct your questions directly to the speaker that you'd like to ask the question. They can come back up to the mic. We also have the commissioner of our social services department, Kit Kephart, in case there's a question that is directly for that department and Kit's work. So thank you everyone for being here, and we'll just direct any of the questions and speakers will come up and answer them.
So the question was, after having considered multiple locations, why did this stick out? So we were looking at the size of certain lots, and this lot provides 1 acre, so that's significant within the city of Ithaca. So it allows us more space to within which to work to develop something purpose-built. It's within walking distance to many facilities in the downtown area. It's within the site of where some of the current unhoused encampments are, so we know that it's within that area as well. And it does not displace other local businesses that we were taking all of those things into consideration. So we thought that this site would allow us the greatest flexibility to develop a purpose-built facility. Can try to address that too. I think the best way to address the timeline for this project is to talk about some of the next steps and components in the development process. So as I mentioned in some of my remarks, we are going to be contracting with MMDA Associates to assist us as a consultant and with their development team in this process. And it's strongly recommended, and we very much want to find a nonprofit shelter operator with whom to partner with on this project. So we will first be looking and probably releasing, hopefully within the coming weeks, another request for proposals from nonprofit shelter operators to join us in this development project. Then they would be ideally part of the development team with MMDA in the team so that they can help to develop from the ground up and come up with a plan with which to apply for the HHAP funds. Ideally, that would be this year. And then contingent upon receiving those funds from the state in conjunction with the local funds that the county is committing, we could then move forward with the design and development phase. So I think that, we would like to see all of that happen within the next year if possible.
So I think the city stands ready to work with our county partners. The exact form of that has not yet been determined, but I would point you to the city's 2025 budget, of course, including a capital project for support of a low barrier shelter system, for lack of a better word. And I think those conversations will continue. We recognize the city is going to play a junior role in whatever occurs here, but we stand ready to continue to work with these folks to ensure that we are able to develop better public health and housing solutions for our unhoused residents.
I think we're going to work with our design consultants to figure out the best approach, but we would envision probably starting from the ground up for a purpose-built facility. But we will certainly wait and see what is recommended to us.
I just wanted to add one quick comment based on an earlier question, and that, which is, one of the reasons we chose this site, at least it was favorable to many of us, is that we do have the ability here to build from scratch. Up till now, all the sheltering, all the pieces of the sheltering system, we are reusing other buildings, and we have come to understand that is not ideal, that when you built it from scratch, you can design in all kinds of things that are helpful to the clients, to the staff, and to the community. And so we're really looking forward to making a state-of-the-art design that's going to help and be good for everybody.
So the question was, what kind of design elements are we considering or might we like to see in a new shelter? And again, part of what MMDA and Associates brings to the table are team members who have worked and designed other projects similar for different special needs populations and incorporating best practices in those designs. So I know that use of green space, flexible spaces, and the option to be able to incorporate bringing services into the space and having spaces where our community partners might be able to deliver programs or services to assist the people who are staying at the shelter.
I think at this stage, if there are any further questions, please feel free to approach any of the speakers today individually for direct interviews if you have them. But again, thank you everyone for being here today. We will distribute the information from Tompkins County shortly after. And yeah, please follow up with any of the speakers or other guests today if you have further interview questions. Thank you for your time.